Welcome to Your Infinite Health. Are you getting older?
Are you feeling it?
How would you like to do that in reverse?
We're your host,
Dr. Tripp
and Lene.
We've run an integrative medicine practice for 13 years.
Together, we have 60 years of combined experience helping clients.
We've helped tens of thousands achieve success in health and live longer, happier lives.
In this show, we'll cover peer-reviewed and evidence-based integrative approaches to creating the health you've always wanted.
We also share professional experience we see in the field every day.
So if you're ready to feel, look, and live your best life, you're in the right place.
Welcome to Your Infinite Health podcast.
All right, Ms. Risa, thank you so much for joining us. Happy to have you on the show today.
Thank you for having me. It's great to be here.
Yeah, well, I'm curious to get your origin story and how you came to be interested in functional nutrition and specifically the autoimmune, natural reversal of autoimmune disease. Let's get into that.
Yeah. So, I grew up in a home where my mother was perpetually on a diet and she was always trying to lose the 5 or 10 pounds. And my grandmother was doing the same thing at her house. And we had these, good foods and bad foods. And I was very confused because I always thought the bad foods tasted really good to me. So I had a really struggle. I struggled with my relationship with food. And sure enough, when I was in high school, I started dieting and, this deprivation, starvation thing. And then it took me years to kind of put my relationship together with food, realizing that it's our fuel, right? And we shouldn't be choosing foods because they're good or bad, but what fuels us. And then I was always interested in nutrition and I got married and had my first child. We conceived like immediately on our honeymoon, no problems, no issues. And then when I was trying to conceive our second time, it just wasn't happening. And then I would have a couple of miscarriages and it went on for a few years. And I went to a fertility specialist and they did some testing. And next thing you know, we're sitting at his desk and he pushes over a script for me and says, "You've got an underachieving thyroid and you need to take this pill." And I said, "Oh, for how long?" And he said, "Oh, every day." And I said, No, for how long?" And he said, "Oh, for the rest of your life." So I walked out of that appointment thinking two major questions, right? Why is it that my thyroid is not producing the hormone that it was actually born to create, right? And why is the doctor not even wondering why? And why are we not even looking at how to have it produce what it's supposed to produce? So that kind of started me on my journey and I started doing some research and why I wasn't getting pregnant. And I discovered that I had this very common gene mutation called MTHFR that most people have. I test everybody in my office for it and it can lead to miscarriages and infertility. Go figure. So I started taking a B vitamin in methylated form. And next thing you know, I got pregnant on my own and had a fully fine pregnancy and started figuring out what's happening with my thyroid. A few years after my son was born, I went to a naturopathic doctor. They did some blood tests and realized that I now have Hashimoto's. So I'm like, whoa. So now my body's actually creating antibodies and attacking my thyroid, thinking it's the enemy. And are we not worried about this? So that's really where I stepped into gear and I started to figure out what those root causes would be that I would have this autoimmune disease. I had never really heard of much autoimmune diseases. And I went back to school for nutrition and I became a clinical nutritionist. And then I found functional medicine and became a functional nutritionist where we look at root causes and prevention. So that's what I did. I created a root cause list. I put it in my book, Food Frame. I went down that list. Of course, I had every single one of those root causes. So it took me a few years to address them all, but I was able to reverse my Hashimoto's.
That's cool. Just out of curiosity, what were you doing before you went back to school for nutrition?
Yeah, I was completely before I got married. I was director of marketing for the hockey team, the Ducks, the Mighty Ducks at that time.
Oh.
And then when I had my children, I stopped working, but I was always reading books on nutrition, and I kind of used my kids as guinea pigs because I never gave them sugar and fake foods. I just gave them real food and see how they did, and they were not as sick as the other kids. Right? They didn't have perpetual ear infections or attitude issues or anything like that. So behavioral issues. So it was awesome. I was able to really see how food affects us.
Right. You you made your own children's baby food from scratch?
Yep.
She like that woman on that movie, Diane, was that Diane Keaton movie, where she was making the food. You know what I'm talking about? It's an 80s movie.
Yeah, I don't remember that one.
Working Mom. I think it was Working Mom.
Oh, maybe that one. Yeah.
So how was that process? That sounds like a major undertaking.
It really wasn't a lot because you would just take vegetables or fruit or whatever it is that you were having, and I would steam it, and then I would puree it and put maybe a little bit of almond or coconut milk in there, and then there was your food.
That's awesome.
Sprinkle a little sea salt so you get some minerals, and they had real food.
Very cool. Very cool. I bet that helped them growing up be acclimated to more vegetables and proteins. I mean, that's a struggle with a lot of kids. I know my kids were like carnivores for the longest time before they would venture into proteins. And even to this day, even as teenagers, it's a struggle to get them to eat something green.
Yeah, it's funny. I always said in my house, you have to eat something from the farm before you eat something from the factory. And I always had a plate of vegetables with hummus or olives or something from the farm that they could have when they came home from school. So I made it accessible for them. And both of them are out of the house and after they graduated from college, and they both meal prep and they both eat a lot of vegetables.
Nice. Well, talk about some of the misconceptions that you run into in your practice with respect to autoimmune diseases.
So a lot of people come into my office with an autoimmune disease, and they have gone to the doctor, and the doctor basically gives them a pill. I say that's a squirt gun because we have a raging fire in the basement, right? When we have autoimmunity, we have major Th17 gets activated. It becomes a cytokine storm. We have major systemic inflammation. And if we don't put that fire out, we're likely to accumulate more autoimmune diseases. So when they go to the doctor, typically conventional medicine, the paradigm is a pill for an ill, so they give you a pill. And, perfect example is I'm working with this woman right now, sort of at the tail end because she doesn't really need me anymore, but she came to see me late 30s, and she was in full body pain from rheumatoid arthritis. She was about a 7 or an 8 out of 10 every single day. She's in
her 30s?
Yeah, in her 30s with 3 kids. One of them was special needs. So she was like not sleeping great. And she had major skin issues, blisters on her hands, and she would have hives. It was really bad. I don't know how she sustained a life like that, and debilitating fatigue. So we changed her diet, and I did my blood panel and my stool test, and we were able to, I put her on the AIP protocol, which is the autoimmune protocol, for 90 days. And every single symptom went away. Every single.
Wow. In 90 days?
In less than 90 days, about 60 days, I would say, maybe even earlier than that. And she went back to the rheumatologist, and he walked in and he said, "How's that pill going?" And she goes, "Well, I don't know." And he said, "What do you mean?" And she said, "I've never taken it." He said, "How are you doing?" And she goes, "I'm completely out of pain." Of course, I think she lost 35 pounds along the way because weight loss is a side effect of wellness. So we focused on her wellness, and she was able to reverse that. Now, I don't know. We haven't tested her yet for her RA markers, again, to see if she's still creating those antibodies, but she's completely asymptomatic.
Nice. And so that program, is it specifically just focusing on nutritional changes?
Yes. The AIP protocol is a nutritional program, but anybody who comes into my office with any kind of antibodies, I'm going to give them my Fab 5. So that's vitamin D, omega, resveratrol, turmeric, and glutathione, our master antioxidant. So that is going to be, it's like the fire hose for this fire that's raging, right? And so that and their food, we're putting them on a fully anti-inflammatory program for, again, 90 days. And it works. I mean, it's just amazing. I did it myself. I've done it for a ton of people. I've seen some really amazing things reverse.
Nice. So is all the foods, like, do you do any allergy testing or any genomic panel and looking at, any genetic predisposition to foods? Does that make sense?
Yeah. So I do. Yeah, I do a lot of genetic testing, but it's optional. I don't say that it's mandatory for everybody. If somebody wants to see what their genetics are to nutrients, absolutely. I'm a big encourager because, it's really what loads the gun, right? Our lifestyle and our environment is what pulls the trigger, but it is really good to know. And I used to, when I first started my practice decades ago, I would just do a food allergy test. I'm like, this is awesome. We have all this data, what you can eat, what you can't eat. And then I started realizing that some people can't really hardly eat anything. And I realized this was not the problem. This was the symptom of the problem. The problem was that we had this major leaky gut and these gaping holes in the intestinal lining, that these foods were going in through the intestinal lining, going in through the back door, and the body says, who are you? You're the enemy. And it starts to create antibodies, right? And they've been probably doing this for a long time because those antibodies eventually need to find a place to park. They're going to look for a gland, a cell, or an organ in which to park itself, right? That's where we get autoimmune disease. So I'm really looking at the leaky gut. Everybody in my office gets a stool test. So I'm looking to see how leaky you are, but are you creating your own digestive enzymes? How do you do with fat malabsorption? What's your inflammation? So on and so forth. I'm looking at the good guys, the bad guys, any overgrowth. I'm looking at Giardia, H. pylori, worms, parasites, fungus, yeast. And then I do a full extensive blood panel. So I want to see all your inflammation markers, where conventional medicine does not test for that, which is insane to me. So I look at vitamin D. I look at an iron panel. I'm looking at 4 markers of blood sugar. I'm looking at 9 markers of thyroid, not just your TSH, but all 9 markers of your thyroid. Antibodies is are your hormones affecting your thyroid, and is your inflammation or your cortisol production affecting your thyroid. And at that point, I have a really good idea of where we're going next, right? So what is unique to you? And that, and then we do it with a food program. But while we're collecting that data, you're on my detox for 2 weeks while we're quelling the inflammation in the system and taking out the foods from the factory.
Okay. Trip, you have any thoughts? You're muted.
Yeah, no, that's because of our family pets.
Yeah.
So yeah, no, I find it, ultimately very refreshing to hear kind of the confirmation of all the things that I've seen over the last decade or two, doing the integrative and functional component of our. Interestingly, I kind of fell onto that coming out of conventional oncology, and with the nutritional aspect and all that. It's really interesting to see that, I'd have patients with lupus and rheumatoid arthritis and these autoimmune disorders, and I'd get them on these on a low inflammatory or low carb, and isolate those things that they seem to be reacting to, and then oops, all of a sudden, their lupus is gone, the symptoms and signs of the arthritis are gone, basically the end organ dysfunction modifies itself and comes back into normal functioning parameters. Wonderful stuff, and all just by virtue of the fact of taking care of what we need to be getting into our system, so that we're not accosting our genome. And,
Exactly.
And really just fascinating stuff. And it puts an end. It actually puts an end to that suffering that we unfortunately inherited behavior wise from our predecessors, our parents and our grandparents, and all that good stuff, but it really wasn't good stuff. So
Right. And things they didn't really teach you in medical school, I'm assuming.
exactly. No, absolutely not. Absolutely not. And, I think that also the fact that we have a much better idea of the biological aging process and the role of even minute amounts of inflammation and toxic environment in our body now is really bringing all to the fore, that we can really probably avoid a lot of the damage to our genome, or accosting the genome, so to speak, by just living and eating well and going back to the roots, so to speak.
Eating foods from the earth, right?
Exactly.
As it turns out, food actually matters. What you eat has a major impact in your health.
Mm-hmm. Yeah, and the whole field of nutrigenomics, that's just flowering at this point. We're getting all this information that's coming out. And you had the well, maybe the good fortune of finding out you had an MTHFR mutation that predisposed to just a ton of things because of the cellular impact of the non-methylation of folic acid. So really fascinating stuff. And I'm really encouraged. Actually, a lot of this starts from the West Coast. It's taking a little longer to get this direction. I think certainly in the hub of obesity and nutritional toxicity here in New Orleans, we're slowly but surely gaining ground, but really interesting to see the results and the fantastic results that we get with inflammatory disease processes.
Yeah, I think the frustration, at least what I experience from most people that come into my office, I'm the last stop. They've been to several physicians. They don't have answers. They still feel like crap. They're on more medications. And it's this bad paradigm that we have. And it's not the doctor's fault, right? Because it's what they've been taught. And then
exactly.
Right. And then we nurture them with the pharmaceutical companies, and the insurance companies say, oh, you want to run your own practice? Well, we're going to tell you how to do it. Right. If you want to get paid, we're going to tell you how it's going to work. Right. So your hands are tied. And
exactly.
It's really, it's got to be super frustrating for physicians. And I can tell you that the average person who is diagnosed with an autoimmune disease sees 6 physicians before that diagnosis.
Wow.
And I agree with, everything you say. The paradigm is what's driving the issue, unfortunately. And it's an unfortunate disaster that what we learn in medical school, granted, all the basics are there, the science is there and all that. But towards the end, as we're taught how to address the issues, it goes immediately to either a pharmaceutical or a procedure, or some type of manipulation that actually does not address the cause of the problem. It's the end result and the symptom of the problem that's being addressed. And so getting back to, as you said, the roots and getting good nutrition in, and that is just so key to resolving so many of the medical problems that we have today. Yeah,
absolutely. And I work with a lot of physicians as patients, and I love that because they have a great, an outsized impact on who they're teaching and who they're helping. So I love that. And I do have hope. For the first time, I feel like the functional message is louder than it's ever been. And I think people are sick and tired of being sick and tired. And I think they're really embracing a different way of healthcare.
And you're right. It's always many of the people that I see at the end of the day, are addressing problems that multiple physicians have been involved, and biopsies and this and that and all the technology that's been applied, and then at the end of the day there's still no answer, and they're getting a symptomatic treatment or a highly toxic symptomatic treatment with the pharmaceutical, and that can be resolved easily just by lifestyle change is, I guess, not easy sometimes, but
it has a major impact.
That's the impact. That's where it is.
Right. Exactly.
Right. Yeah. I find it interesting though, when you're asking somebody to engage in behavioral modification with the way that they've been eating their whole life, it can be quite the challenge. What do you see with respect to that? Like, what are your clients most struggling with? Is it that they're being asked to, because you can feel like you're being deprived because you can't have this thing because this isn't serving you, and you've got to swap it for this thing that will serve you. Do you find patients are resistant to that?
The 2 major hurdles I really find people having a hard time with is wine. Wine's a big one. And sugar. Big one too. But we have so much more involved in food because we have a lot of emotion tied to it, right? Where we reward ourselves, we punish ourselves, We celebrate with food. We use food for so many different things that we don't actually use when we brush our teeth, right? We don't drive home from work going, oh my gosh, I hope I have so much toothpaste in my toothbrush, my toothpaste tube, because I'm just going to brush my teeth a lot, right? But we are thinking, oh my God, I hope there's some cherry pie left in the refrigerator because I'm going to dive into that, right? So we have a different emotional attachment to food. And it's very cultural, and different cultures have different rituals with food. So it's even though it's our fuel source, just like we have to brush our teeth, we have a completely different mindset with it because it's very emotional. So people come in, and there are some people who just can't make changes, right? And no matter what we do, they're just not there yet. I believe they'll get there at some point, because I always say you get what you get when you do what you do. Right? It goes both ways, right? If I would get up and I work out most days, I'm going to get what I get, right? But if I decide to eat Twinkies instead, I'm going to get what I get. So it's really the difference between who you are and who you want to be is what you do.
Wow.
So, right? And so it's little baby steps every time you're taking something into your mouth. Is this a food that's going to help me or hinder me? So and what do you really want? Sometimes people say they want, but they don't really, really, really want it. They're not willing to do the work, right?
Right.
And I always say to people I'm very fortunate. I've met many, many very successful people, and I am friends with an elite athlete who is one of the most decorated athletes of our time. And I've been able to work with athletes, and I've worked with artists and people who are quite successful in business, or people who are very successful in relationships. It doesn't matter where your success is. They all possess the two same attributes. One is sacrifice. You have to make some sacrifice even when you don't feel like it. And the other is consistency. Even when I don't feel like, going and working out, I'm going to do it anyway. Even if I don't feel like having that salad instead of the chips and guac, I'm going to do it anyway. And I may have a little chips and guac, or I may do it another time, but I'm 99% of the time going to choose the real food, the protein, fat, and fiber, right? So it's those little decisions that make health, right? Just like it makes any success in anything that you do, right? When I talked to that world decorated athlete, he didn't make it ever. He never went to a high school football game. And I was shocked. And I said, you've never been to a high school football game? He was a full grown adult in his 40s. He said, no, I went to the pros when I was 15. Wow. So what a sacrifice that was for him. He missed all his high school fun, right? He missed a lot of things for his kids because he was on the road. So we don't tend to look at his sacrifices. We look at his celebrations, but behind every successful person or entity is a lot of sacrifice.
Yeah. Something's going to give somewhere.
Yeah, you got to earn it somehow, right? Nothing's given to any of us.
Got to give to get. Got to give to get.
Exactly.
Cool. You have a book, Food Frame. Talk about that.
Yeah. So Food Frame is my methodology that I created after doing nutrition for years and years and years. And I would put everybody on the same anti-inflammatory protocol. I realized that some people were excelling and some people weren't. So I realized we probably should be eating very differently. And I now believe that we should all be eating according to our current health status. So if you have IBS or SIBO, small intestinal bacterial overgrowth, you probably should be eating a low FODMAP program for 30 to 90 days. And if you have autoimmunity, you should be eating, take out nightshades and eating more of an AIP protocol. Perhaps you have some blood sugar dysregulation. And if you qualify for all the things that would make up a successful keto program, that's something I would recommend. So, and then I break down 6 different major diet types that I usually work with in my office. And I have a lot of stories in there. I give a lot of information. And so that's my methodology, and it's been working 100%. For everybody. Everybody seems to thrive when you eat according to your health status. And when your health status changes, so does your diet type, right? So you're eating maybe you're eating more nuts or seeds or whatever it is for you that you hadn't been before in order to heal. And then once you're healed, you can eat differently.
No, I like that idea. Very cool.
We all got a new book, right, that comes out by some, amazing person, and everybody's reading it. And, 60% of the people are thriving, but you do it and you're like, something's wrong with me. Why am I not thriving on this? Right. it's because of that, right?
Yeah. Well, people can get lost in information overload.
Mm-hmm. For sure.
For sure. And okay. And then you have an online, is it a do-it-yourself thyroid
I have an
program?
online course for thyroid because I went through every which way and back. And so I put everything I know into the thyroid course. It's called Achieving Optimal Thyroid Health. And I break down if you have hyper or hypo or Hashis or Graves or thyroidectomy, and what supplements to take, what supplements not to take, what foods to eat, what foods not to eat, and most importantly, how to read your blood work. Right. Ask your physician for these particular markers, how to interpret them, what's optimal, and what's where you should start paying attention.
Cool. Okay. What is one thing you want the listeners to know?
I would really urge people to look at their toxic load. We have more toxins in our society than we ever have. We are at 86,000 chemicals approved by the FDA, more than any other country on this planet. Most of them aren't even tested. And we're at about 2,000 to 6,000 approved per year, regardless of who's in the White House. So this is something that we have some control over. It's our candles, our shampoos, conditioners, our beauty products, our nail polish, our everything, all your house cleaning, and your food. So if you read a label and it sounds like a chemical and you don't have it in your pantry, probably best not to eat it. So I really urge people to detoxify or just decrease their toxic load, because it is very damaging. And I think we're going to see a tremendous amount of infertility in the future because we are just really causing havoc on our endocrine system.
And you have a detox program as well, right?
Yes, I have the RGN Detox, and it is collagen shakes, collagen plus amino acids and antioxidants that help gently open up pathways 1 and 2 for gentle detoxification. And it's 2 shakes a day. And then you're eating protein, fat, and fiber. I'm a big fan of protein, fat, and fiber at every meal, every shake. And then you are eating real good food, protein, and all the vegetables you want, any way you want them, except for deep fried. So it might be difficult for some people.
For sure.
Sweet potato, yams, and good fats, eggs, nuts, seeds, olives, olive oil, avocado oil, coconut oil. People do lose weight, but it is not a weight loss program, but it is a side effect of wellness. We store our toxins in our fat cells, so that's why we lose weight. But you want to clean those toxins out of the system and optimize your function of your liver and all your other organs.
And how long is that? Is that a 90-day or
2 days? 14 days.
Okay, 14 days. And then is there a maintenance protocol after that?
Well, I do recommend to take my food frame quiz on my website to find out what is your food frame. So after that detox, you'll, or you can do it before the detox and just make tweaks along the way of what works for you.
Cool. All right. And then where can everybody find that and more information about you?
Yeah, on my website at Risa, R-I-S-A, Groux, Groux, nutrition.com. My course is on there, my product line that is super, super clean. My detox is on there. My book is on there, and tons of testimonials and information as well. And the food frame test quiz. It's 12. Yeah.
Cool. Okay. Well, listener, you definitely want to go there. And I think Risa was generous in giving us a code.
Yeah, we're going to do Infinite 10, the number 10. For 10% off the RGN Detox. And I work with people all over the country. So I do it via Zoom. So you can just head to the website and get in touch with us and we'll get you scheduled.
Awesome.
Great. That's great. I have a patient that I think would really benefit from having a discussion with you.
Excellent. Well, we can watch him heal together.
Autoimmune issues, young woman. Yeah. 30s.
Right.
Yeah.
Cool. All right, yeah, we'll talk about that later. All right, Risa, thank you so much for all that information. I learned a lot. Listener, I hope you learned a lot as well. And I hope you found it, I don't know what I say, interesting, educational, somewhat entertaining. And until next time.
Thanks for subscribing to Your Infinite Health. I'm Dr. Tripp.
And I'm Lene. Until next time, feel it, look it, and live it.